health systems, all kinds of systems broadly, and how those experiences affect kids. I also look at the juvenile justice system and sort of how that system functions, whether it functions as intended as sort of a rehabilitative system or a helping system, or whether it ultimately harms kids. Early onset antisocial behavior, so antisocial behavior that occurs in childhood rather than adolescence, crime prevention and public policy, and applied quantitative methods. So my previous research has focused on the associations between school suspension, delinquency, and justice system contact. So in previous research, I have looked at how this association varies by age. So are there differences in the relationship between school suspension and delinquency according to when a child was first suspended? That happened in adolescence or childhood. And also pathways from school suspension to delinquency. So looking at what happens after a kid is suspended and how that increases risk of arrest or delinquent behavior in the future. I've also done research that looks at child delinquency. So this is specifically delinquent behavior or justice system contact that occurs among kids 12 and under. So what happens to those kids after they've experienced that sort of early onset delinquent behavior or justice system contact? So I found that kids who experience justice system contact early on experience secondary sanctioning effects. So they are significantly more likely to be arrested regardless of their behavior. They also experience decreases in their odds of high school graduation, increased frequency arrest, all sorts of negative consequences for those kids. So today I'm going to be talking a little bit about a project that I'm working on right now. I've been working on it for quite a while now, and I think it's at a good stage where I'm ready to sort of take it to the next step and submit the paper. So the title of the project is Contextualizing the Secondary Sanctioning and Secondary Deviance Effects of Arrest. So this project relies on the theoretical framework that's provided in the labeling perspective of criminology. So a lot of my research looks at the labeling perspective and relies on the labeling perspective. And broadly, the labeling perspective argues that labeling events can lead to secondary sanctioning and secondary deviance consequences. So secondary sanctioning consequences refer to the effects of a labeling event on subsequent consequencing from agents of social control. So this is, for example, in my line of work, the effects of an arrest on subsequent arrest, after we account for the effects of that initial event on behavior. Secondary deviance effects look at how a labeling event influences behavior, independent of sort of its effects on official sort of formal contact or regulation by agents of social control. The labeling perspective also argues that status characteristics impact who and what is labeled. So according to the labeling perspective, not everyone experiences the same sort of risk of being labeled via a labeling event. Some status characteristics influence whether or not an individual's behavior is recognized as deviant and sanctioned. So things like race, gender, age, all of those sorts of things influence an individual's risk of being labeled. And then finally, the labeling perspective suggests that the response of societal actors to a label will dictate access to future opportunities, others, institutions, etc. So in this paper, I'm looking specifically at how age and race influence the response of societal actors following a labeling event. So previous research has identified persistent secondary sanctioning and secondary deviance effects associated with arrest. So this research tells us that kids who are arrested in adolescence are more likely to experience arrest in early adulthood or later adolescence than kids who were not arrested, controlling for a host of things or using matched samples. And this research also identifies this persistent secondary deviance effect. So these kids are more likely to experience an escalation of antisocial behavior than kids who were not arrested. But in looking at or concentrating its examination to to looking at the effects of labeling events in adolescence, the research is sort of ignoring what happens to kids who are arrested before adolescence. And so this is really important because in 2018, just under 63,000 kids 12 and under were referred to juvenile courts. So this is a big number. This number it may also be an underestimate because this only includes kids who are actually referred to the system. So it's really important to understand consequences for this age group and how those consequences may differ for kids who experience justice system contact at older ages. Additionally, previous research has sort of failed to examine differences in labeling effects, not only by developmental time period of the labeling event, but also by race. So this is really important because the labeling perspective suggests that the consequences of labeling events may not be consistent across racial and ethnic groups, across gender, across age, etc. And so this lack of examination of moderation effects is a pretty big gap in the literature. There have been 2 studies that have looked at moderating effects, one for age and one for race. And those preliminary results suggest there may be differences. However, both of those studies rely on the same sample, the same data set, and the data set is limited only to individuals ages are in grades 7 to 9, so 7th to 9th graders. So it's a pretty small developmental time frame, and again, one data set. So we need more research that looks at whether or not these labeling effects vary. So the purpose of this study is to identify and compare secondary sanctioning and secondary deviance effects associated with arrest first experienced in childhood and adolescence, and then to examine if these relationships vary by race. So specifically, I used subsamples of white and Black participants and then looked at differences there. So in order to do this, I used data from AdHealth, the National Study of Adolescent to Adult Health. I don't know if any of you guys are familiar with AdHealth. It has kind of a complicated sampling design. So I used information from waves 2, 3, and 4. So I'll talk about it in the next slide, but my dependent variables were measured waves 3 and 4, and then I pulled some control variables from wave 2. So my analytic sample includes just under 4,000 youth, 3,703 individuals who had complete information on offending and arrest in waves 3 and 4. So this analytic sample excludes individuals who are missing information on my dependent variables and age at first arrest. So if they had a real missing on age at first arrest, then they were excluded because they didn't feel comfortable imputing that information. And then obviously individuals who were missing on their dependent variable were also excluded. So the measures that I used in my study, age at first arrest was a retrospective measure. This was assessed at wave 3 when participants were on average 18 to 24. So participants were asked at wave 3 if they'd ever been arrested, age 18 or under. And then if they indicated that they had been arrested age 18 or under, they were asked to report when they were first arrested. So that was the measure that I used to generate my age at first arrest measure. I did collapse it down further to reflect 2 developmental time periods. So individuals arrested 12 and under in childhood, or individuals arrested 13 to 17. I didn't rely on a continuous measure here just because there are so few people who are arrested in childhood. I wanted to bulk that up as much as possible. And then my dependent variables, there were 2 of them, self-reported offending in waves 3 and 4. So this is a composite measure. It's a sum of 13 items assessing past year involvement in offending behavior. And then arrest count is a continuous measure, but it was created using individual reports of how often they've been arrested. So they were asked at wave 3 and then again at wave 4. Then there's a pretty sizable gap of time between waves 3 and 4. It's somewhere between, depending on the individual, around 7 years. So it's a pretty large gap of time. I included a bunch of time invariant measures to control things like race, gender, self-control. Self-control is hypothesized to be invariant in criminological literature, so it was included as a time invariant control. I also included a measure of offending and behavior in adolescence to try and account for that in my estimation of the relationship between age at first arrest and secondary sanctioning and secondary deviance. Age at wave 3, incarceration. So this was a time invariant measure, but it reflected whether or not the individual had ever been incarcerated by wave 4. So that's the same time as my final measure of my dependent variables. And then to adjust for sort of opportunity to engage in offending behavior or for arrest, it also included a time invariant measure of time incarcerated. So this was generated by using individual reports of how much time they'd spent in a jail or prison at the wave 4 interview. And then I included time variant measures, things like employment status, food stamp enrollment, if they were married or not, their highest level of education attained, mental health status, and reports of victimization. So in order to look at secondary sanctioning and secondary deviance effects, I used a mixed effects negative binomial models. And I also used random intercepts by individuals, so had longitudinal data. So originally my plan was to use a fixed effects model because I really wanted to try and reduce bias in my estimates by accounting for that unobserved individual heterogeneity. However, there are a lot of problems with fixed effects count models. According to Paul Allison, fixed effects count models aren't actually true fixed effects models. because they don't sort of perform like you would expect a fixed effects model to perform. And I also wanted to get estimates for these time invariant measures, so I ended up using a mixed effects approach. So Allison recommends that when you use this mixed effects approach, you should be calculating individual level mean and deviation measures for time variant variables. So that is what I did. And then I ran separate models by race, and then the ad health data is does have a fairly complex survey design, so I counted for survey weights in my estimation, and then used robust standard errors. So here are the results. These are the results for secondary deviance. So these tell us the effects of arrest experienced first in childhood or adolescence, controlling for a host of things, on offending behavior in adulthood. So this is the self-reported offending. Controlling for self-reported arrest. So this is just the effects of on offending. So when we look at the full sample, you can see that individuals first arrested in childhood, age 12 and under, had a higher, there was an increase in rate of self-reported offending behavior as compared to those not arrested. Similarly, individuals first arrested in adolescence had an increased rate of offending as compared to those first arrested, or those not arrested, I'm sorry. And then when we break this down by race, we see some really interesting things. So for kids who were first arrested 12 and under, there are significant increases in rate of self-reported offending behavior in adulthood. And though the increase is larger for Black participants, the standard error makes it such that there's not necessarily a significant difference between those coefficients. There may well be a substantive difference. And so I'll interpret it as such, but the significance difference isn't there. But interestingly, for Black and white participants, there's a non-significant increase for those first arrested in adolescence. So this actually sort of reflects what we hypothesize in criminological theory. I'll talk about that a little bit later, but I think these results are fairly indicative of sort of life course persistent offenders versus adolescent limited offenders. And so these are the results for secondary deviance or offending behavior in adulthood. So these are the results for secondary sanctioning, or justice system contact or arrest in adulthood. So you can see in the full sample of the just under 4,000 individuals who were first arrested in childhood or age 12 and under experienced a significant increase in rate of arrest, accounting for the effect of arrest in childhood on behavior. Individuals first arrested in adolescence also experienced that significant increase in secondary sanctioning or rate of arrest. But when we break this down by race, we see some really interesting differences, particularly among those first arrested in childhood. So for white participants first arrested in childhood, the association between arrest in childhood and secondary sanctioning was not significant. There was a significant relationship for arrest in adolescence and secondary sanctioning. For Black participants, though, there was a significant increase in rate of arrest for individuals first arrested in childhood. So there's a difference there between the association of first arrest in childhood and secondary sanctioning between white and Black participants. So what does this mean? I'm still working out what this means. So any sort of potential interpretations are greatly appreciated. So first and foremost, my findings suggest that there is evidence of both secondary sanctioning and secondary deviance effects in the full sample. So when we don't break it down by race, we see broad sort of evidence that individuals, regardless of when they were first arrested, if they're arrested in adolescence, they experience secondary sanctioning and secondary deviance effects. These secondary deviance effects appear to be stronger for those first arrested in childhood, and this is consistent with criminological theory. Specifically, theories that sort of fall under this life course perspective. They suggest that individuals with an earlier onset of antisocial or delinquent behavior are more likely to continue engaging in that behavior. They're what Moffat refers to as life course persistent offenders. But generally speaking, age of onset is one of the stronger predictors of offending behavior at later ages. And so this isn't surprising. It's also not as surprising that I didn't find secondary sanctioning effects or weaker secondary sanctioning effect or secondary deviance effects, for individuals first arrested in adolescence, because again, they might not be these life course persistent offenders. So their odds of continuing to engage in deviant behavior should be lower. That's what theory tells us. Interesting though, I did find significant secondary sanctioning effects for adolescents, and those appear to be stronger than the secondary sanctioning effects for individuals first arrested in childhood. So this, I can go back and show you, so when we look at the secondary sanctioning effects, they were the increase in incidence was almost 3.5 as compared to 2.59. So this to me could indicate some ensnaring. Ensnaring is sort of a concept in the life course literature that refers to when adolescents get caught up in the negative consequences associated with an arrest. So it's possible that the negative consequences associated with an arrest increase risk of future arrest for adolescents. So this, breaking down to a simple example, would refer to, for example, if an adolescent was placed on probation and then they got arrested again for violating, for a technical violation, which means they sort of violated the rules of their probation. They didn't necessarily engage in delinquent behavior, but there was some sort of technical thing that they didn't do correctly that was in their rules of probation. So that could increase their risk of arrest. So that could be the difference there, could reflect some ensnaring effects. I also saw differences in secondary sanctioning and secondary deviance by race. So specifically for Black children, there were significant secondary sanctioning and secondary deviance effects. So for Black participants, if they were first arrested in childhood, ages 12 and under, they experienced significant increases in their rate of offending and in their rate of arrest. White children, however, experienced only significant increases in secondary deviance, so only increases in their rate of offending, not in their rate of arrest. So I'm trying to work out what this means. I think it could perhaps be reflective of differences in reintegration and exclusion following a labeling event. So the labeling perspective hypothesizes that individuals who experience a labeling event are more likely to face exclusion from pro-social opportunities than others following their labeling event. So for example, if a child is arrested, they might not be allowed to participate in certain after-school activities or certain clubs. They might not be allowed to attend their school. They might be sent to an alternative school. So those are sort of these negative consequences that follow the arrest event, or the labeling event. So it's possible those consequences differ among Black children and white children. And so that could potentially be contributing to these differences in secondary sanctioning effects. It's also possible that these differences are reflective of differences in parental support or access to resources. So it may be that because of different social structures, white parents are better able to integrate their children following a labeling event, to reintegrate their children, to ensure that their child doesn't receive sort of excess monitoring from police or excess supervision. And so that could also be contributing to this difference in secondary sanctioning that we see between Black children and white children. So there are a number of limitations associated with this study, a number of limitations. The first is that there's a really small number of children who are actually arrested in ad help data. This is a limitation that I come across all the time. While there were, as I mentioned before, 68,000 kids in 2018 referred to the juvenile justice system, there's not a lot of longitudinal data that has information on a large number of these children. So I usually work with small numbers, and the ad help data are no exception. So that is certainly a limitation. I'm also potentially controlling for mediators. I wanted to try and get sort of the most conservative estimates that I could get of secondary sanctioning and secondary deviance effects. So I did introduce these potential mediators as control variables, but it's entirely possible that in introducing things like delinquent behavior in adolescents, educational attainment, that I'm controlling for mediators. And so I could in some ways be underestimating secondary sanctioning and secondary deviance effects there. Also, another really big limitation is this retrospective measure of age at first arrest. So unfortunately, due to the data, that's sort of what was available. It has to be a retrospective measure, but it's possible that participants didn't accurately recall their age at first arrest, particularly if they experience more frequent incidents of arrest in adolescence. So if they were arrested more frequently, that measure may be less reliable. But the study, though it does have some limitations, it does also have some potential implications for future research and things I would like to look at. So I would love to look at mediation to see what's actually happening to explain these secondary sanctioning and secondary deviance effects. I don't believe I can do that with ad health data, unfortunately, because there are so few kids who are arrested. But I would love to find a data set that would allow me to look at pathways between an initial labeling event in childhood, specifically justice system contact, and subsequent secondary sanctioning or secondary deviance. I would also like to look at additional moderators. I did try looking at gender or as a moderator. However, the number of participants who were identified as female and experienced childhood justice system contact was so low that I didn't really feel comfortable proceeding with those analyses. But I think additional moderators like gender or parental support to see if parental support can sort of buffer the secondary sanctioning and deviance effects associated with childhood arrest would be really interesting and sort of necessary contributions to the literature. So future research, if I can find a good data set, I think those would be areas that I would like to explore. So really quickly to sort of wrap things up, I wanted to talk about future projects. So as I mentioned, that's a project I've been working on for a few months, trying to get the model correct. These projects are things that are sort of in new stages. They're IRB proposals and or things I'd like to pursue in the future. So these projects are in the beginning stages. These are projects that I currently have IRB proposals under review. So hopefully they'll be progressing beyond the beginning stages, but that's where they're at right now. So one is looking at the net widening effects of diversion. Excuse me, diversion programs are relatively new, I guess, in the juvenile justice system or in juvenile justice systems across the country. And so the goal of diversion programs is to keep kids out of the system, to reduce or to decrease the number of kids who are actually formally adjudicated delinquent. But there's been some criticism about diversion programs in arguing that diversion programs are actually net widening. So rather than keeping kids out of the system, kids who wouldn't typically have been referred to the juvenile justice system at all are now being referred because there's this potential for them to participate in a diversion program. So rather than receiving sort of services elsewhere in a different system, they're being referred to the juvenile justice system. And so that widens the net of kids who ultimately come into contact with the juvenile system. And so the goal of this project, we're planning to use data from the Florida Department of Juvenile Justice. And we're going to use a multi-group propensity score approach to match kids based on sort of what diversion program they were enrolled in versus kids who were just removed from the system entirely, who might have had an arrest or referral, but their case didn't move forward, to see if there are net widening effects of diversion. So we're going to look at the effects of referral to these programs on recidivism. I also have a project that I'm working on currently that looks at child delinquency in the Florida juvenile justice system. So the reason that the Florida juvenile system is being used for these projects is because they have a really solid data collection system set up. So there's lots and lots of data available. So that's one of the reasons why I use their data. So this one looks at child delinquency in the Florida juvenile justice system. So using a sample of kids and adolescents who are referred to the juvenile system in Florida, I want to compare ACEs. So to see if perhaps sometimes children are being referred to the juvenile justice system 12 and under because individuals in positions of authority perceive the child as in need of help. So ACEs are obviously a measure of exposure to trauma broadly, a flawed measure, but a measure that is sort of recognized across disciplines. So I would like to see if perhaps if children with a higher number of ACEs are more likely to be referred to the juvenile justice system. So I would compare ACEs between child offenders and adolescent offenders and see if the kids coming into contact earlier are kids with higher number of ACEs. I'd also like to look at what we're doing with these kids. So to compare dispositional differences between children and youth. So to see if children, for example, because maybe judges see them as in need of more supervision or higher risk, are more likely to experience sort of more punitive sanctions, regardless of the offense, than adolescents. And then finally, I am planning to look at law enforcement policies on arrest of kids or training on child development and child arrest rates. So I've collected child arrest rates per county for each county in the state of Florida over the past 5 years. That's publicly available data on the Florida Department of Juvenile Justice website. So the plan is to match that with census data for each county so that we have sort of information about the county, what the county looks like, and then to contact law enforcement agencies to get information on if they have an official policy about arresting kids. So if, for example, law enforcement officers are told not to arrest someone who looks like they're 5 or 6, but to instead call parents, or if law enforcement officers are provided with some sort of formal training on child development so that law enforcement officers understand, or at least they're given tools to understand how kids differ from adults, and sort of how kids maybe should be treated differently from adults. And then look at the relationship between the existence of these policies or this training on child arrest rates for that county. And then finally, future work that I don't necessarily have any active IRB proposals for. I would love to look at the labeling effects of police stops in childhood. So the Fragile Families data set is national longitudinal data set, and it does have information on a fairly large number of kids who were stopped 12 and under. There's just under 130 of them. That's a really big number, at least for what I'm used to seeing. So I would love to look at the labeling effects of police stops in childhood, and then potentially look at some of the mediation that I couldn't look at using other data sets with this data set. I would love to look at the effect of minimum ages of juvenile court jurisdiction on, to use that as kind of a natural experiment to look at the labeling effects of arrest in childhood. So there are some states that have a minimum age of juvenile court jurisdiction, such that kids under a certain age, whether that be 10 or 12, can't actually be referred to the system at all. So there's a natural sort of experiment there where I could use kind of regression discontinuity or interrupted time series type approach to compare those kids who were just under the minimum age with those kids who were just over the minimum age to try and get at the labeling effects of contact. And then finally, I'm planning in the future to do some work with ACEs and school exclusion. So this is something that I've done in the past, looking at the relationship between exposure to adverse childhood experiences and risk of suspension or expulsion. The ACEs sort of theory hypothesizes that ACEs lead to externalizing behaviors or sort of coping behaviors, whether those be externalizing or internalizing, and that leads to some of the negative consequences that are associated with ACEs. So given what we know about the behaviors that increase a child's risk of experiencing school exclusion, I also hypothesize that ACEs might increase risk of school exclusion through their association with these behavioral manifestations. So that's also something that in the future I am hoping to look at more. And that is all for me.
Thank you very much. It's time to take questions. If anybody has questions, just chime in, please.
Yes. Is there a question? No?
Can I ask you a question?
Yeah, go for it.
Well, it was a very nice presentation. Thank you so much. It was a very great opportunity to know what you do. You're new to our school, and now we know what you're doing. So when you did these analyses, did you account for their income at their house? I missed that part.
I accounted for whether or not they were enrolled in food stamps. So not necessarily their income directly, but if they were receiving some sort of government assistance.
I see. Yeah, because you mentioned about the parental support. So it's probably very proportional to how much income they have at home, and that may reflect how much support they have after having these incidences. Yeah,
definitely. I didn't account for income in childhood, and so I think that might be, I'm not sure if that's available in the data. I don't know if the kids were asked about sort of services that the parent was receiving, but I did account for income in adulthood. I think that's something, though, looking back at the data to see if an income measure in childhood is there, would potentially be more, or would be a better thing to include than income in adulthood of the actual individual themselves.
Thank you.
Yeah, of course, thank you.
Any other questions?
I thought that I enjoyed your presentation, Evie.
Thank you.
And in working with older adults with the ACE measures, one of the things that has been coming up more often now is because of the relationship to longevity in older adults is resilience. And so in listening to you, I wondered if any of the research that you're working with is measuring these younger children's natural resilience and whether that is the characteristic that separates the two groups.
Yeah, I'm not familiar with any sort of resilience scales. in younger kids, I do know there is really interesting research that has two researchers, Belsky and Plus, they looked at resilience in terms of kids' exposure to early caregiving settings. So if the child was in a daycare environment or a childcare environment, and so they looked at child temperament as sort of a predictor of whether or not the child's subsequent functioning and sort of middle childhood was affected by their early care environment. And so they did find some differences that they attributed to resilience, because they found that some kids with a certain temperament were simply more or less likely to be affected by a negative care environment than kids who had a different temperament. And there were also kids with a certain temperament who were more likely to be positively affected by a positive care environment and more likely to be negatively affected by a negative care environment. So this sort of environmental susceptibility piece, they tied into resilience, but I'm not sure of any resilience sort of scales that are looking at the effects of sort of justice system contact in childhood. I know it's something that's talked about for sure in juvenile justice system literature, not as much within the labeling perspective specifically, because the labeling perspective is it's more focused on the effects of decisions imposed upon an individual by agents of formal social control, but it's certainly something that would be interesting to look at.
Thanks.
Abby, yeah,
Yes.
great job.
Thank you.
Just some potential suggestions. I'm sure you've likely already gone down that route. If not, to probably incorporate into the paper related to the central piece that you presented on, because obviously in the literature there's different operationalizations of age of onset, right? Most frequently, they use under age 14, which I guess related to your operationalization, which is also common too. The only difference would be you would add the 13-year-olds to the children group, right?
Yep.
And so you might want to just do that just to see if you're, the stability of your results, whether or not you have those two alternative operationalizations, kind of a sensitivity analysis check in case reviewers might ask. And then relatedly, I think it would be helpful if you haven't done to potentially have just a bivariate analysis of the relationship between age and the prevalence of arrest, right? Yeah. So essentially, because that would help us see if the 12 versus 13 are different or 13 versus 15 are different, right? But also to you could even graphically illustrate that, essentially the age crime curve, right? Yeah. From 13 to 17 among this sample, that would provide some good context for interpreting your results.
Yeah, absolutely. I did try the 14 and under division because I was concerned I wasn't going to have enough kids 12 and under. So I did try it. I put the 13-year-olds back with adolescents just to keep with that whole sort of when an individual is technically a teenager versus childhood. But I did try it and the results were basically the same. So I put the 13-year-olds with the teenagers.
Be a perfect footnote.
Yes, perfect footnote for sure. But I definitely, the addition of a graph, I think breaking it down would be really interesting because there are so few kids who were arrested in childhood, but certainly they're the ones that are experiencing they're experiencing a lot of negative consequences. So that I think would be very interesting. See, there are some questions on the chat as well. So the first one is there data about the number of arrested kids with disabilities? There might be. Is the question broadly or referring to ad health specifically? I can interpret it broadly. Yes, there is data about the number of kids arrested with disabilities. The data might look, it's probably going to be hidden within certain different data sets. I'm not sure if the Department of Juvenile Justice has a breakdown. You might be able to access it. It's probably within some of their surveys, but it's something you'd probably need to go through your DJJ IRB for. And other DJJs across the country might have that data. But there is literature about kids who have disabilities coming into contact with the juvenile justice system. particularly kids with these behavioral labels. So things like ODD, ADHD, ADD, there's a lot of research on that because a lot of kids who come into contact with the juvenile justice system have those labels. So that's something that there's definitely data out there about that. Geographic indicators in unhealth. I'm not sure if the geographic indicators in ad health would be available in publicly accessible ad health data. So I don't have the restricted data. I just have the one that I could download from the ICPSR. So that is certainly a possibility. I think, would that potentially, yeah. It would potentially influence whether or not an individual was arrested in childhood. Fortunately or unfortunately, only 29 of our 50 states have a minimum age of arrest. And a lot of those minimum ages are ages like 6 or 7. So they're ages that are just so low that it doesn't really count as a minimum age in some ways, because there just aren't that many kids that are being arrested at that age. So I think a geographic indicator would probably be helpful to control for state-related effects, state-related fixed effects. But at the same time, I'm not sure if that would actually influence the measures of age at first arrest, just because what minimum ages do exist in statute aren't, the minimum age isn't old enough to actually influence the amount of kids that are being arrested in this sample anyway. Age group, quite different, and secondary deviance. Yeah, it does seem like there's differences in secondary deviance for individuals first arrested in for Black participants first arrested in childhood versus adolescence. And I think I would attribute, so first of all, I would say that those differences are, there might be substantive differences there, but they're not significant differences because the standard error is really high. So I think that the differences there probably reflect what we in sort of life course work talk about as an accumulation of disadvantage. So Black participants in the sample are likely experiencing disadvantage from a whole host of social structures, not just the juvenile justice system, but differences in sort of experiences within the education system, differences in sort of family opportunities or family structures that are resulting from different sort of social structures. And so that, I would say, is probably some of the difference, is that it's possible that that Black children experience a greater increase in rate of secondary deviance because of this longer accumulation of disadvantage that's associated with their initial labeling event. I think that's all of the questions that were on chat.
All right. Well, thank you so much for presenting today. We enjoyed your talk, and it was very informative, and it's good that we know what you're doing.
Yeah, thank you very much.
After this presentation, after this evening, by this evening, I will send you a survey of this presentation to everybody. So I appreciate if you can respond to our survey. Thank you very much. See you again.